Hello, this lecture will be going over Chapter 26, Concepts of Basic Nutrition and Cultural Considerations in the Fundamentals textbook. Nutrition is the sum of processes involved in taking in nutrients and absorbing and using them. It is concerned with the properties of food that build sound bodies and promote health. The functions of nutrients include providing energy, regulating body processes, and building, maintaining, and repairing tissue. The following slides will be an overview of the structure and function of the gastrointestinal system, and this will be a review from our structure and function and anatomy courses. This picture can be seen on page 467, figure 26.1, showing you the gastrointestinal system from start to finish. What are the functions of the organs of the gastrointestinal system? Well, the mouth receives food and breaks it into small particles by chewing and mixing it with saliva. We know that the teeth are used for grasping, tearing, crushing, and grinding food. Saliva plays a role in the chemical digestion of starches, and it is important to recall that from our previous studies in structure and function. The pharynx will serve as a passageway for food to enter the esophagus through swallowing. The stomach is a temporary storage place for food. Vitamin B12 is absorbed in the stomach through the action of the intrinsic factor, which is secreted from the stomach wall. The small intestine receives food from the stomach and secretions from the liver and pancreas. The process of digestion is finished in the small intestine. The liver will produce and secrete bile into the small intestine for the digestion of fats. The gallbladder will store and concentrate that bile. The pancreas will secrete digestive juices into the small intestine to aid in the digestion of carbohydrates, proteins, and fats. What changes occur in the digestive system with aging? Well, we have a decreased ability to chew food normally. We have a loss of appetite. There's an increased risk of choking and aspiration. A decreased muscle tone at the sphincters can increase heartburn or the risk of esophageal reflux. Decreased peristalsis can increase the risk of constipation or bowel impaction. MyPlate was developed by the U.S. Department of Agriculture Center for Nutrition Policy and Promotion to promote healthy diets for all Americans. MyPlate is consumer-friendly and easy to remember because it visually demonstrates that about half of your typical food should come from fruits and vegetables. The 2015 to 2020 guidelines include the following recommendations. Follow a healthy eating pattern across the lifespan. Focus on variety, nutrient density, and amount. Limit calories from added sugars and saturated fats, and reduce sodium intake. Stick to healthier food and beverage choices, and support healthy eating patterns for everyone. The guidelines further define a healthy eating pattern to include vegetables from all subgroups, fruits, especially whole fruits, grains, and at least half should be whole grains. Dairy should be fat-free or low-fat, or fortified soy beverages. Protein, including seafood, poultry, eggs, legumes, nuts, seeds and soy, and oils. The guidelines say that we should define a healthy eating pattern by limiting saturated fats, added sugars, saturated fats, sodium, and alcohol. Serving should be divided into 3 main meals and 2 snacks. Be sure to look at the American Heart Association 2015 Diet and Lifestyle Recommendations. This is in box 26.1 on page 469. It's very important to know and understand these recommendations to be able to promote them to our patients and have a better lifestyle. Education is one of the biggest ways that we can make an impact with our patients. So knowing recommendations like this is a great way to start doing that. It's important to note that you would want to reduce foods high in dietary cholesterol and aim to eat less than 300 milligrams of cholesterol each day. Issues such as obesity and food insecurity have been evident in low-income ethnic communities, especially among the females. 6 nutrients that need to be supplied in adequate amounts from foods are essential to normal functioning. This includes proteins, carbohydrates, fats, vitamins, minerals, and water. Protein is essential to meet the body's need to replace and build tissue and cells. Protein plays a role in maintaining fluid balance and acid-base balance by transporting nutrients and producing antibodies, enzymes, and hormones. Protein is also a source of energy for the body, and it supplies 4 calories per gram. Proteins are composed of amino acids. These are the compounds that are the chief components of proteins. Amino acids are the building blocks of proteins. 9 amino acids are considered our essential amino acids. This is because they must be consumed through food sources. The essential amino acids are indispensable and they cannot be made by the body. The liver can manufacture 11 amino acids, and we consider these the non-essential amino acids. Food sources of protein include meats, poultry, fish, eggs, dairy products, cereals, grains, legumes, and most vegetables. Animal sources are considered complete or high-quality proteins because they contain all 9 essential amino acids. Plant sources of protein are considered incomplete or low-quality proteins because they do not contain all of the essential amino acids. Combining plant sources of foods or complementary proteins can provide complete protein intake in the diet. For example, cereal with milk, beans with rice, and peanut butter sandwiches. Dietary reference intakes, or DRIs, have been developed by the National Academy of Sciences to provide guidelines for estimating nutrient intake for planning and evaluating the diets of healthy people. The average DRI is 46 to 56 grams of protein per day for the healthy adult. Protein intake should be approximately 10 to 15% of the total daily calories. The DRI for protein can vary depending on your activity level, state of health, and the availability of protein food sources. The body will require more protein during times of illness or injury for processes such as cell repair and antibody production, and during times of rapid tissue growth such as pregnancy and lactation. To determine the protein requirement per day for a healthy adult, you can calculate it as follows. Weight in pounds divided by 2.2 will get you the kilograms. Then you take your kilograms and times it by 0.8. That will get you the grams of protein that you should consume per day. That can also be seen on page 471. Millions of children under 5 are affected by a lack of protein intake. This lack of protein can lead to permanent disabilities. Marasmus is a form of protein energy and nutrient malnutrition. Marasmus is the result of severe starvation. The body will use its carbohydrate and fat sources for energy. Catabolism of muscle mass for energy usually results in heart, lung, and kidney damage. Kwashiorkor is a condition occurring in infants and young children soon after weaning from breast milk. It is due to severe protein deficiency, and it differs from marasmus in that adequate energy from other nutrients may be consumed. However, the diet is deficient in protein. The average American diet supplies 1.5 to 2 times the DRI for protein. High protein diets for people who do not require a protein increase can be stressful on the liver and kidneys. Many people have become vegetarians as a means to maintain their desired weight and also decrease the amount of animal fat in their diet. Cultural, religious, and personal factors can also influence the choice of vegetarianism. The primary types of vegetarian diets are as follows. Lacto-ovo-vegetarian. They consume dairy products, eggs, and plant foods. Lacto-vegetarians will exclude eggs. Instead, they include dairy products and plant foods. Vegan diets will include all animal food sources, including honey, exclude all animal food sources. Vegans will exclude all animal food sources, including honey. A vegetarian diet must be planned to include the essential nutrients. This is a challenge to plan meals that provides adequate levels of complete proteins, vitamins, and minerals. Vegans in particular may have a diet deficient in vitamin B6, vitamin B12, iron, zinc, calcium, riboflavin, and vitamin D. The more limited the vegetarian diet, the greater the individual's risk will be of nutritional deficiencies. Nutrient requirements can be met by combining categories of food to meet protein needs by following a modified version of the MyPlate. Soybeans are a legume high in protein, and they contain all 9 essential amino acids. A nutritious diet can exist when the incomplete proteins are combined each day by eating a variety of protein-rich plant-based foods. Carbohydrates are the body's main source of energy. Carbohydrates should make up 60% of the daily caloric intake. Each gram of carbohydrate supplies 4 calories. The 3 major forms of carbohydrates are simple carbohydrates, complex carbohydrates, and fiber. Carbohydrates are a quick source of energy and are easily converted to glucose, the fuel for our body cells. Glucose is the metabolized form of sugar in the body. It is found in table sugar, known as sucrose, fruit sugar, known as fructose, and milk sugar, known as lactose. Glucose is chemically nearly identical to dextrose, so these words can be used interchangeably. Although simple sugars will cause a quick rise in blood glucose, the levels will fall rapidly, and this can result in a return to a hunger state. Complex carbohydrates are also known as starches. This includes foods such as breads, pasta, cereal, potatoes, and rice. Starches provide a more consistent blood glucose level than simple sugars do. Experts recommend that 85% to 95% of carbohydrates consumed should be complex, and very little should be simple sugars. Children and adults need a minimum of 130 grams of carbohydrates per day. Most Americans need to increase consumption of complex carbohydrates and decrease their consumption of simple sugars. Dietary fiber is the portion of carbohydrates that cannot be broken down by the intestinal enzymes and juices. Food sources of fiber will include whole grain cereals, the skins of fruits, vegetables, and legumes. Fiber increases bulk in the stool, leading to good intestinal function and elimination. Health experts recommend 21 to 38 grams of fiber per day for adults. Fiber content in the diet can be increased by practices such as replacing white bread with whole wheat bread and white rice with brown rice, or eating whole grain cereals and pastas. Increasing intake of fresh fruit and vegetables, beans, and peas will also increase fiber intake. It is not desirable to use concentrated fiber supplements in place of dietary fiber because dietary fiber will contain many needed vitamins and minerals. On page 473 in table 26.1, we can see the fiber content of selected foods. Notice the high fiber content of the unpeeled apple, the peeled apple, the banana, and the shredded wheat. Fats, or lipids, are essential nutrients. It supplies a concentrated form of energy. Fat supplies 9 calories per gram consumed. Other functions of fat include providing a source of fatty acids, adding flavor to foods, and contributing to texture, dissolving and transporting fat-soluble vitamins and fat-soluble phytonutrients, insulates and controls body temperature. Fat makes food smell appetizing. It cushions and protects our body organs, facilitates the transmission of nerve impulses, and it gives us a feeling of fullness after eating. Fats are made up of fatty acids and glycerol, called triglycerides. Fatty acids are classified as either saturated fats or unsaturated fats, depending on the amount of hydrogen that they contain. Fats can be of liquid or solid consistency, and fats that are liquid at room temperature are called oils. Omega-3 fatty acid can be found in salmon, trout, halibut, sardines, tuna, canola oil, soybean oil, omega-3 rich eggs, and walnuts. It is the most unsaturated form of fatty acid. These types of foods should be added to the diet as sources of unsaturated fat. Solid fats, which are saturated fats, include shortening, margarines, and lard. Animal food sources provide the most saturated fatty acids, and vegetables, nuts, or seeds supply unsaturated fatty acids. There are 3 essential fatty acids: linoleic acid, found in corn oil, safflower oil, and sunflower oil; oleic acid, found in olive oil and beef; and linolenic acid, found in green leafy vegetables, walnuts, pecans, soybean oil, and soybean products. Deficiencies of these 3 fatty acids can lead to illness or skin problems. Most Americans consume more fat in the diet than is needed to maintain health. The recommended daily allowance of fat is 20 to 30 grams per day. A component of fat is cholesterol. This is linked to heart disease and hardening of our arteries. Cholesterol is found only in animal products and oils, such as palm and coconut. Vitamins are organic compounds that are essential to the proper function of the body. They are best consumed through food sources. However, vitamin supplements can provide the nutrients that we need. Vitamins are classified as fat-soluble or water-soluble. The fat-soluble vitamins are vitamins A, D, E, and K. Because they are stored in the body, these vitamins can cause toxic effects if they are ingested in excessive quantities. Vitamin A can be produced in the body by carotenoids, like beta-carotene. Carotenoids act as antioxidants. These protect the cells and tissues from damage by free radicals and have been shown to increase immunity, improve vision, and have a role in cancer prevention. The water-soluble vitamins include the B-complex vitamins, such as thiamine, riboflavin, niacin, vitamin B6, folic acid, vitamin B12, pantothenic acid, and biotin, and of course, vitamin C. Minerals are inorganic substances contained in animals and plants. These are essential for metabolism and cellular function. Minerals are categorized as major minerals or macrominerals, or trace minerals, also known as microminerals. Minerals are necessary for proper muscle and nerve function, and they act as catalysts for many cellular functions. Because mineral actions are interrelated, a deficiency of one mineral can affect the action of another mineral in the body. Other functions of minerals include maintaining the rigidity and strength of teeth and bones, facilitating contraction and relaxation of muscles, and assisting in blood clotting and tissue repair. Generally, sufficient minerals can be supplied by a balanced diet. The body does not manufacture its own minerals, and therefore all of them must be provided through food sources or other supplements. Water is the most essential of all nutrients. The water requirement for adults is approximately 1 milliliter per calorie of intake. Water is used in every body process, from digestion to absorption to elimination and secretion. Water is not stored in the body, and what is lost during 24 hours needs to be replaced. A general rule is that the patient should take in an amount equal to the recorded fluid output, plus 500 mLs. Factors that influence nutrition are very variable, and a dietitian should be consulted if malnutrition or risk of malnutrition is suspected. Age is a factor. Infants are dependent on others to meet their nutritional needs. Nutrition can be provided to them via breast milk or formula. Adolescents are strongly influenced by their peers. Their food choices will often consist of fast food and pizza variety. Eating disorders are very common during this growth period, especially among adolescent girls, but the prevalence of such disorders in adolescent boys is increasing. Poor dentition or difficulty swallowing will often affect an older person's food intake. Malnutrition can often mimic dementia, and older patients showing signs of dementia should be evaluated for any nutritional deficiencies. Illness is a factor, and nutritional needs usually increase during illness. However, a loss of appetite can occur due to pain, nausea, vomiting, and stomatitis. Emotional status is a factor, and an individual's emotional state will have a strong influence on their eating habits. Be aware of a patient's response to stress and take any opportunity to intervene if nutrition is compromised. Economic status is a factor, and individuals with limited income can benefit from patient education related to good nutritional choices because a balanced diet can be affordable even with a low income. Social workers and dietitians can also be helpful in recommending community resources that can provide nutritional intervention and programs. Religion is a factor, and religious practices and affiliations will influence nutrition by dictating food preparation, foods allowed, and foods to avoid. Some common religious food practices include the Islam practice of no pork or pork products and no alcohol. In the Judaism faith, kosher is how all of the foods should be processed, grown, and harvested. Meat and milk cannot be eaten at the same meal. For the Seventh-day Adventist faith, no stimulants can be included. Shellfish, pork, and alcohol must be avoided. Culture is a factor, and individuals are more likely to consume foods with which they are familiar. Food safety is also a serious issue because of several incidents recently have been linked to illness and death with contamination of foodborne pathogens. The most common culprits of this are norovirus, salmonella, Clostridium perfringens, Campylobacter, and Staphylococcus aureus. Fruits and vegetables should be washed thoroughly before preparation. Ground beef should be cooked until well done, no longer pink at all. In addition, the use of household bleach, 1 tablespoon to 1 gallon of water, is acceptable for decontaminating utensils and surfaces. Culture has an influence on nutrition. See the clinical cues in page 480 in the purple box. Consult with or refer patients to the dietitian or nutritionist to provide foods that the patient will find acceptable to eat. Allowing the family to prepare and provide food for the patient can be a means to ensure proper nutrition. Family members can be advised of any restrictions required because of any specific medical needs. The African American culture includes typical foods like a variety of greens, dry beans, cornbread, sweet potatoes, pork, catfish, and chicken. These preferences can sometimes contribute to high fat, sugar, and salt content in the traditional African American diet. The Hispanic population is one of the fastest growing in the United States. The Hispanic diet is high in carbohydrates, such as beans, rice, corn, and tortillas. Preferences for fried foods can also lead to a high fat content in the diet. The traditional Asian American diet is high in carbohydrates and vegetables and low in meat and fish. However, dishes can still have a high sodium and high fat content. Food preferences among the Middle Eastern cultures include fermented dairy products such as yogurt, meats, grains, in the forms of wheat or rice at each meal, fresh fruits, and vegetables. The nurse and dietitian can help patients modify diets to meet nutritional requirements. Dietary counseling should include modification of the culture's traditional diet to accomplish a healthier composition and preparation while maintaining the diet's basic components. The first year of life will mark the fastest growth period in human development. The American Academy of Pediatrics recommends that infants be breastfed or receive breast milk for the first full year of life. Breast milk can also provide immunity to most childhood diseases through the first few months of life. Breast milk will rarely cause allergic responses in the infant. Infant formulas are similar in composition to breast milk. However, nutrients in human milk are more easily digested and absorbed. An advantage of bottle feeding is the opportunity to share the feeding responsibility with other caregivers. Feeding can be a time to build an emotional bond with the infant. Breastfeeding mothers can pump their breasts so that the infant can be bottle fed by other caregivers. Pediatricians prefer adding solid foods to the diet at 4 to 6 months of age. However, some healthcare professionals encourage later introduction of solid foods starting at 9 to 12 months. This is in order to decrease the further risk of food allergy or sensitivity. The infant's gastrointestinal system is still immature and unable to digest cereal before 3 months of age. Introducing solid foods before 4 to 6 months of age will also increase the risk of the infant developing food allergies as their immune system matures. Solid foods should be introduced gradually, one at a time. This will provide an opportunity to identify allergic responses. A single grain cereal, such as rice or oatmeal, would be a good initial choice. Another new food can be introduced in about a week. Each new food should be a single item. After the first year, as the child shows evidence of tolerating solid foods, weaning from the bottle or breast milk should be considered. During the toddler and preschool years, the growth rate tends to level off. The child will consume less milk and increase their intake of solid foods. Specific food preferences may be evidenced, such as mashed potatoes and gravy, and then the child will suddenly refuse the items. Parents can use some of the following guidelines to assist their toddlers to eat. Provide a pleasant environment at mealtimes. Avoid combination foods. Toddlers prefer single item foods that are not touching each other on the plate. Provide plates and utensils that in a size that can be easily handled by a child. Provide small servings. Include finger foods for active toddlers. Use dishes that are colorful or contain pictures of favorite characters. Avoid forcing a child to eat. Offer foods that are easy to chew, and try colorful foods. School-age children can be influenced by their peer group when making food choices. They are susceptible to advertisements for fast food that show toys as a prize, and children can play in areas when eating. Children should be served a well-balanced breakfast before they leave for school, and they should be taught to make wise choices from the school menu. An increasing number of children come home to school to an environment that does not have adult supervision. Snacks high in sodium and sugar should be minimized or avoided. Many physiologic changes will occur during the adolescent years. The growth spurt and social and emotional changes related to puberty will have a great effect on nutrition and eating habits. During the growth spurt, which occurs with girls ages 10 to 5 and 14, and boys ages 12.5 to 14, the body will require more calories and nutrients, such as the B vitamins, calcium, and iron. Adolescent girls are very aware of their appearance, and concern about weight can lead to eating disorders, resulting in inadequate calories and nutrients for growth. Parents can assist their children by providing snacks high in calcium, iron, and protein, decreasing the preparation of high-fat foods. Teach them how to select more healthful choices from fast food restaurants and prepare a healthier version at home with friends. Keep sparkling water and low-fat milk available instead of high-calorie sodas. Keep vegetable sticks and fresh fruit available as a snack choice. Raising children, working, and fulfilling family responsibilities will influence the eating habits of most adults. Many adults will rely on fast food or convenience foods to meet their nutritional needs. Lifestyle and dietary recommendations for adults will include decreasing fat and sodium intake, decreasing intake of simple sugars, increasing fruits, fresh vegetables, and whole grains in the diet, preparing more meals at home where fat and sodium content can be controlled, and increasing their activity. Patient education about good nutrition and making healthy choices is also important. Older adults are the group most at risk for inadequate nutrition. Many factors will influence the eating habits of the older adult, including economic status, physical disability, chronic disease, access to food sources, and physiologic changes. Nutrient requirements do not change with aging, except in the presence of illness or disease, although calorie needs can decrease each decade after age of 50. Physiologic changes, such as a decrease in taste and smell, can decrease the appetite of many older adults. Many older adults have lost spouses and friends through death, and eating alone can be very unpleasant for many individuals. Some older adults have limited incomes and have to limit their food choices. Families can prepare meals that can be frozen and easily heated by older adults. Another concern for older adults is living alone and salinity. Many older adults with memory loss may not remember eating or may not eat for long periods of time. Family intervention to provide supervision of meal preparation and eating can ensure that that person is eating nutritionally and preparing foods safely. Observe the patient for any potential nutritional problems during the admission assessment. When a patient is admitted to an acute care facility, the Joint Commission dictates the nutritional screening must be performed within 24 hours. The nutritional assessment begins with a complete medical, family, and social history. Begin the physical examination with observation of your patient's general appearance, performing a general survey. Look at their body mass index. The recommended BMI is 18.5 to 24.9. Serum albumin or protein, hemoglobin, and hematocrit will indicate on lab values whether or not a patient is at risk for malnutrition, is anemic, or is dehydrated. After completing a nutritional assessment, determine whether or not a nutritional problem is present. Make a nutritional referral to the dietitian with the primary care provider's permission if any malnutrition or nutritional problems are identified. Interventions for nutritional care include assisting the patients with the meal tray, feeding when necessary, providing enteral nutrition or total parenteral nutrition when needed, performing patient education about proper diet, encouraging adherence to a therapeutic diet, and monitoring your patient's nutritional status. Create an attractive and pleasant environment for eating. When serving trays from the dietary kitchen, serve the patients first who can feed themselves. Check each tray against the unit dietary order list to verify that the correct diet tray has been prepared. When dietary personnel deliver meal trays, the nurse is the one responsible for positioning the patient and setting up the tray to promote food and fluid intake. Depending on the patient's nutritional problem and type of diet prescribed, the following points may be included in a patient's educational plan. An ideal weight for their body height and build, caloric intake needed to maintain their ideal height and weight, any need for added calories, proteins, and vitamins to promote healing, foods high in iron and vitamin C that are used to build iron stores, use of frozen or low salt or no salt canned vegetables, how to read food labels to determine the content and caloric value of various foods, use of a variety of herbs and spices to enhance the taste of food, use of small frequent meals which can be more appealing when an appetite is diminished, methods increasing the amount of vegetables and fruit in the diet, methods of shopping wisely for prepared frozen foods when limited time is available, and utilize resources such as community food banks, SNAP, and WIC for patients with limited financial resources.